Welcome. I am Dr. Norman Johnson, and I am grateful to the Academy of Orthopedic Physical Therapy for the opportunity to present the functional reach and multidirectional reach assessment device and clinical utilization method, a recipient of the 2024 First Quarter Innovative Practice Award. Objectives for the presentation: review the history of the functional reach and multidirectional reach tests, discuss the limitations of the traditional functional reach and multidirectional reach tests as compared to utilizing the innovative functional reach assessment device. Discuss the clinical therapeutic activities performed by utilizing functional and multidirectional reach. Discuss relevant legislation supporting fall screening and identify how to locate your U.S. representative and U.S. senator, and discuss why advocacy for increasing the utilization of fall screening is important. 3 questions for the presentation. Are you familiar with the functional reach and multidirectional reach tests? Do you use the functional reach and multidirectional reach tests? Are you open to learning about using innovative functional reach assessment device to perform functional reach and multidirectional reach tests and clinical applications of functional reach activities? Here's a picture of the functional reach assessment and treatment device. This adjusts vertically, has inch marks on it to determine the height, and can be lowered to accommodate exercise mat and the wheelchair. Research. The first research on functional reach dates back to 1990 by Pamela Duncan and colleagues. The article, Functional Reach, a New Clinical Measure of Balance. The study compared the results of the functional reach using an electronic functional reach device versus a yardstick taped to the wall. Upon review, the measurements were very similar. 2 years later, Duncan and colleagues in 1992 looked at a VA population of men. They looked for people who had falls versus non-falls. And the title of their article, Functional Reach, Predictive Validity in the Sample of Elderly Male Veterans. What they found was adjusted odds ratio. If you could reach beyond 10 inches or 25 centimeters, the patient was at low risk of falls. A reach of 6 to 10 or 15 to 25 centimeters, 2 times greater risk. 6 inches or less or 15 centimeters, 4 times greater risk. If the patient was unwilling to reach, 8 times greater risk. Roberta Newton in 2001 looked at multidirectional reach in her study, Validity of Multidirectional Reach, a practical measure of stability in older adults. The big thing gleaned from her research was numbers established for forward reach, backward reach, right reach, and left reach. In 2014, Tantasuit and colleagues did the multidirectional reach, an investigation of the limits of people aged between 20 and 79. Most noteworthy was this was the first study of an Asian population, and it established multidirectional reach scores for 6 age groups from ages 20 to 79 years of age. In 2012, an APTA textbook, Adult Fitness Examination of Physical Therapy Approach by Milrood and Chu, advocated for the use of functional reach in the assessment of adult fitness. The International Classification of Functioning, Disability, and Health, ICF, domains show body structure and function, and the categories are mobility, walking, and moving around. This falls in Section D, activities and participation. Reach is a functional activity developed shortly after birth and is used multiple times daily throughout a lifetime. Limitations of the traditional functional reach versus innovation. By attaching a yardstick to the wall, the assessment is one-dimensional, whereas a freestanding functional and multidirectional reach assessment device with targets, simulates reaching tasks, and is multidimensional. The innovative functional reach assessment device, making the functional reach and multidirectional reach test freestanding, whereby eliminating the attachment to the wall, the assessment becomes multidimensional. Using a tape measure to determine the shoulder height at 90 degrees of flexion increases future testing efficiency, reliability, and reproducibility. The innovative functional reach assessment device also accommodates seated in a wheelchair and on an exercise mat for functional and multidirectional reach. The utilization of the innovative functional reach assessment device creates a dynamic assessment environment. Here we're using a postural harness, and we're using TheraBand, and we're reaching for called targets. TheraBand is graduated, and you can then determine how many pounds of force or how many kilograms you've generated. Another way is to use a luggage scale, put the hook on, have the patient lean as you hang on, and see how much force is generated. The relevance of practice innovation to patient care and treatment. There is significant value in establishing gait speed, balance, coordination, and mobility test norms when requesting treatment authorization, reauthorization, discharge planning, and establishing patient goals. These tests are efficient and can be administered in minutes. Furthermore, the same surface or device used on the first visit, future testing and treatment is accurately replicated. Benefits of the innovative functional reach and assessment device. It provides a strategy to support stopping addiction and falls for the elderly, or the SAFE Act, HR 1171, and Safe Steps for Veterans, Senate Act 668. It also aligns with the Veterans Administration Initiative for Patient-Aligned Care Team, or PACT, where the physical therapist is embedded as part of the primary care team, allowing direct access to physical therapy services without a separate referral. It's developed from contemporary literature and research, has potential to reduce overall healthcare costs, reduces measurement error, provides objective data to support Medicare G-code modifier for first and 10th and discharge visit, provides an option to perform functional therapeutic activities, reproducible patient position with the tape measure feature, and functions as a dynamic measurement of postural control. Clinical uses of the functional reach assessment and multidirectional reach treatment device. It aligns with falls risk screening legislation. The measurement of forward and multidirectional functional reaches provides objective data. Enhanced treatment of reach and balance problems with therapeutic activities. Simulate activities of daily living requiring reaching, such as lower extremity dressing. It's used in the administration of the 2-minute step test. Veterans Administration, PCP, directed same-day physical therapy PACT visits for fall screening, used to measure low back range of motion, used to perform resistance training and perturbation activities. And it's not limited to just the geriatric patients. Here we see a video of the backward functional reach. And this gentleman had 3 strokes, and you can see how once he gets back past about 4 inches, he loses his balance. Here you see the forward reach gets about to 5 or 6, and he lost his balance. And that's why it's advisable in this picture to use a gait belt to help steady the patient if they do lose their balance. In this picture, we've created dynamic activities. We have a called out colored golf ball. We have the patient reaching on command of whether I call left or right, and I am providing resistance with yellow TheraBand. So here we have reaching for targets with resistance while trying to maintain balance. Earlier, I mentioned legislation, which I will now discuss. In 2024, two pieces of legislation were introduced to expand falls risk assessment. The Stopping Addiction and Falls for the Elderly, or SAFE Act, upon passage, would allow physical therapists and occupational therapists to initiate falls risk screening at the Medicare initial welcome visit, and then annually thereafter for the wellness checks. This results in early identification and intervention. In 2023, there are approximately 59.2 million people in the United States over age 65. On average, 10,000 people in the United States turn 65 daily. This number will continue to grow to 78 million by 2040, which would represent at the time 22% of the population. Also in 2024, the Safe Steps for Veterans Act was introduced with the intent to establish an Office of Falls Prevention within the Veterans Health Administration. The bill would also require annual falls risk assessment to be performed by licensed physical therapists or occupational therapists. This service would be provided to the 9 million registered veterans who receive the annual screening. The importance of legislation addressing falls and their early identification. The CDC reports falls are the leading cause of injury for adults ages 65 and older. Annually, over 14 million, or 1 in 4 adults, reports falling. Increased falls risk screening would help decrease healthcare costs, injury, and pain. The statistics support the passage of increased falls screening legislation, as does the low number of physicians for the populations as identified in the 2023 Brooks Rehabilitation, The Cost of Falling report. Inherent to the name physical therapy, we need to take action on behalf of our patients by improving access to falls screening. The profession of physical therapy is poised to seize this unique leadership opportunity. In 2022, $80 billion was spent on the treatment of falls after people entered the emergency department for care. If we take and look at the Medicare and Medicaid number, this was $56.8 billion. If we take and we look at the utilization of falls prevention through screening of Medicare and Medicare patients, a simple 5% reduction results in $2.84 billion. Whereas if we can cut that down by 25%, you can see on the chart is $14.2 billion. This money could be redirected toward research and reimbursement. How to find your U.S. representative and U.S. senator. The links below are very easy. You enter those in, you put in your zip code, and it gives you who your elected official are for your area. The two areas of legislation that I just presented are what I would call no-brainer legislation that should generate bipartisan legislative support. And remember, mobility matters throughout our lifetime. Thank you for taking the time to view this presentation. And a special thank you to everyone who contributed to the creation, demonstration, implementation of this presentation and the device itself. If you have any questions or comments, please feel free to contact me at mobilitymatterstous@gmail.com. Thank you.